Guys, what's going on? It's Epic Hazard Gaming, and today I want to go back to our surgery games. I'm going to continue our series. What's up for number 2? Ear surgery. Alright, let's get right into it. Nose, knee, ooh, epilepsy. Hmm. These are all from A10. I am going to play all of them. All of these Operate Now games on addicting games. I'm gonna play all of them on here, and then I'm gonna go to A10 and see if there's any extras that weren't on here, and if there are, then I'm gonna finish off my series on A10. But for now, I'm still on addicting games. Alright, me Billy. Billy has lost approximately 60% of his hearing in his right ear. That's one really neat thing is how can they test like a percentage of how much someone has lost of their hearing in their ear? Either way, which causes him continuous problems. So Billy has decided to undergo surgery for a cochlear implant, a device fitted behind his ear that can greatly improve his hearing. Ear. Alright, we need to inject the anesthetic into the vein. Please pick up the syringe. Syringe. Anesthetic. Wait. Oh, anesthetic. Into the vein. I like how it just turned red with blood and then it just went oop, and it just started fading away right then. Good work, doctor. Now we must wait 4 seconds for the anesthetic to take effect. Thor. Before we can operate, we need to shave part of Billy's head. Please pick up the shaving cream. Yeah, shake it. Pick up the razor. Well, you're not as skilled with a razor as you are with shaving cream. You can't just flip it around. I gotta keep on going back over to here. I can't just go. I can't do that. Please pick up the marker. Marker. I'm gonna mark his head. We are ready to make the incision. Scalpel. Ooh. Booby. Alright. The tractors. Tractor here. Tractor here. Pick up the scalpel again. I'm cutting right through the muscle? And the tractors are out there holding the skin back. How does the muscle just peel back like that? It shouldn't even do that. The drill. Oh god. This... receiver stimulator. Place the electrode inside. Alright. pick up the needle. Thread. Oh, thread. I was looking at the needle. How can you how can you put a needle through bone? I know it's possible, but you shouldn't be able to. Bone paste. Move the tractor. This is needle again. Thread again. Sew that one. Sew that one. Sew that. Why would it be activated in 3 to 4 weeks? Why isn't it activated instantly? Ooh. No new modes unlocked. Intern specialist. Ah, this is like my last episode, as normal or hard. Double the points. All right, let's do it. 6% of hearing. There. All right. Syringe. Anesthetic. There. Pull. Inject. 4 seconds. 3, 4. All right. Now, shaving cream. Shake the damn thing. There we go. Alright. Now I need the razor. Alright, marker. Now, scalpel. Buoy. Boovy. I'm going to call it a cauterizer because that's what it is. Tractor. Tractor. Scalpel. Now, drill. There. Receiver, put it in. Put that into the ear. Alright. Needle. Thread. So through bone, which still to me seems not very likely. Alright. Bone paste. Get that up. Release the tractors. Needle. Thread. Through there. Through there. Through there. Haha! 45,000! Woo! That is pretty good. 0 mistakes as well. Whew. That's pretty good. Well, I don't care about avatars. I think in this episode we have enough time to play one more. Slide 3, appendix. Let's do it. Let's get right into it. I'm up for it. I'm up for the task. Play. Give me some game. Let's operate. Alright, meet Tara. Tara was brought to the hospital because of a severe stomachache. She may have appendicitis, which is a possibly life-threatening condition. You need to examine her, and depending on your diagnosis, we may need to take her to the operating room. We will first check if the patient is experiencing pain due to inflammation of the appendix or appendicitis, as it is called. Apply some pressure to the area where the appendix is located to see if it hurts. I don't know where the appendix is. It's on the stomach. Blood test to confirm. Tourniquet. Bound tightly. Right. Tongs. Oh, yes. There. A needle. Insert. That's a butterfly needle. That's very, very, butterfly needles are actually very, very easy to use. Not really easy, but they're really gentle on you if they're used on you. They're gentle. Patient's blood for an increase in white blood cells. White blood cells protect the body from harmful outside influences. Indication that there is a dangerous inflammation in the body. More than 8 white blood cells should be visible in the microscope. Please check the white blood cell count. Tell me if it is normal. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Thank you, doctor. The abnormally high white blood cell count indicates that there is a very high probability that she is suffering from appendicitis. Alright. Since there is high probability that our patient is suffering from an inflamed appendix, we will surgically remove it today. Alright, get the scalpel. Not even marking where you're going to cut or nothing. Retractor. Open. Ooh, she got fat on her? Alright. Ooh. Clean up that blood. So I can cauterize it. See, that's even called a cauterizer on this one. The bleeding stopped. Grab the scalpel so we can continue the surgery. Why? Scissors? I was like, why just poke a hole there? Oh, God. Wedge the muscles out of the way. There and there. 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 One layer away from the appendix. You need to be extra careful when cutting the next layer. Directly under it lie the intestines. If not carefully cut, you could puncture the patient's bowels. I don't want that. Peritoneum? What is that? Tweezers. Another pair. Take scissors and make a small cut. Intestines. I'm ripping it now with my fingers. That is disgusting. I don't really puke easily or nothing, or get upset stomach or none of that crap, but we're now going to pull the appendix out of the patient's body so we can treat it. What do you mean, treat it? Great work, doctor. Now pull the Now grab the intestines and pull out. Great work, doctor. We're Alright, to operate, the patient's appendix is infected and needs to be removed. Grab the tweezers. Doc. Do I need to grab them immediately? Great work, doctor. I'll hold it up so you can take another pair of tweezers and clamp them to the base. Take a pair of scissors and cut the tissue just above the tweezers. Pick up, close what wound? Why are you closing the wound? Ooh. Scalpel. Oh god. Why stitch that up? Great, the appendix has been removed. Suture the wound with the needle so we can put it back in the patient's body. What am I suturing? Oh, I'm suturing it to the actual intestine. Alright. I'm gonna shove that back down in there. Are these gonna be really deep stitches? Oh crap, I didn't mean to click that one. There. Alright people, you saw it. I just went over and clicked something because I saw metal. I actually really did though. So, I'm actually going to take that one away. I'm gonna take that mistake off. Alright. Yep, I'm good. Hard mode. Crap. Testine. Ooh, she hard. Tourniquet. Tap, 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 tap. There we go. Tongs. Cotton ball. Alright. Needle. Poke it in. Push it in. Empty vial. There you go. Let it fill up a little bit. Remove that. And give her a little band-aid. And remove the tourniquet. Too high. Let's see. Scalpel. Now, retractors. We gotta open that up somehow. Ooh. Scalpel, yeah, I was right. Cloth. Dab, 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 and dab. Alright, cauterizer. Cauterize that. Scalpel. Ooh. Now I need the scissors. Cut it that way, and that way. Remove the retractors. Put them in there. My memory is amazing. Pair of scissors to wedge them open. Alright. I couldn't remember between scissors or tweezers. Alright. Retractors. We need one on each side of that. And we need to take those out. And we need to pull that out. The next layer is where I need tweezers. Right. And then skizzers. Yes, I said skizzers. It's just an odd way to say it. It's fun. You don't gotta be normal. You can be weird and everything. Blah, blah. Alright. Pull that out. Grab that. Pull out that intestine. Let me see. Tweezers. Yes, I did believe. Tweezers at the base. Right. Scissors. Cut over there. Needle. Where's this imaginary thread coming from? That's where I want to. Well, that's what I want to know. Take that off, and then scalpel it off for some odd reason. Needle. Let's get this back on going. Move down. Put that thing back in there. Alright. Move them retractors. Now we need a needle. Suture this up. There we go. And a patch. Yay, guys! Look at that! No mistakes! Perfect! Time was good. Hard mode bonus. 72,300! Woo! That was a pretty nice game. You know what, guys? You know what? I'm gonna push it. Let's do one more. One more. One more. One more surgery. Let's do it all in one video. This is going to be an epic 3 video, no surgery. This one can kind of get to you. Kind of will. Trust me, if you can't handle stuff like this, you definitely probably don't want to watch this one. Alright. Let's operate. Your patient Ashley is experiencing breathing difficulties due to deformations in her nasal cavity. Today we are going to surgically reshape Ashley's nose to improve airflow and resolve her breathing complications. We'll also give her nose a more aesthetically pleasing shape. Since this is a heavy procedure, Ashley will first need to be fully sedated prior to starting the operation. Anesthetic mask. Wait for her to fall asleep. Just close your eyes. There you go. It took you long enough. Conscious for a couple of hours. Alright. Retractor. Make an incision. In the column separating the nostrils. I think they meant to say column separating the nostrils. This allows the nasal skin to be lifted off of the tip of the nose. Pick up the scalpel from the table. Alright, good work. We will now use scissors to open the nostrils even further. Is bleeding heavily. Please pick up the cauterizer from the table. Cauterizer. Oh yeah, it's this, yeah. Good work. We will now make a second incision to reveal the septum. This is a thin membrane and is the cause of the breathing complications. We will shorten it to improve airflow. Scalpel. We now have access to the septum. Let's continue to shorten it. Pick up the tweezers from the table. Pair of scissors. Cut it from the bottom. We have now concluded the functional corrections of this operation. Now we will continue with the aesthetic part of the surgery, which is reshaping the nose. Reshaping. Pick up the osteotome from the table. Yeah, this, people, you might want to look away. I'll have to bang it with a mallet. Oh, that actually doesn't look that bad, but now that the bone has been loosened, we can remove it from Ashley's nose. Please pick up the tweezers. Tweezers, let's dig around in there for something. Ooh, that's a little twig of a bone. Not that the bone causing the nasal hump has been removed. We need to smooth the edges. Please pick up the nasal rasp from the table. Nasal rasp. Right. We will now close the open space left by the removed bone. Osteotome. Hey, people, you might want to look away again. I'm going to have to keep on banging this into her nose for some reason. Like I got the last time. Last time I was trying to get out that bone. That little piece of bone to make the nasal hump. But this is just... no. Alright, I fit the bones perfectly together. I already did it. We're almost done. So we can suture the nasal tip back together. A needle. Let's suture that. Let's let that nose get down. Pick up the needle so we can suture the nasal tip back together. Needle. We will now place nasal airway splints in Ashley's nostrils to hold things in place. There. There. External nasal splint. Oh, yes. Over her nose. Alright. Bandage. No time. There we go. 12,300. Let's do this here. Yeah, let's do that. Here in a second. I might have to mute that. No, I do not. Alright. Let's play as a specialist now. Let's do this all by ourselves. Ashley. Anesthetic mask? No. Alright. Retractors. Pull that thing open. Scalpel. Scissors. Cut, cut. Cauterizer. There. And there. Time is of the essence, people. Scalpel. Open that up. Alright. Tweezers. Scissors. Cut that. Osteotome. Put it up there. Mallet people might want to look away. Let's dig up in there for that little bone. Alright. Nasal rasp. Alright. Osteotome again. What about a mallet? Boom. Boom. You might want to look away for that one. Reshape that nose. Alright. Good. We need a needle. We need to sew this back up. It won't let it down until I sew this at least. Alright, now to let it down. Alright, needle. Sew here, sew here, and sew here. Alright. Now, I need airway splints. There and there. External nasal splint. And a bandage. We did a great job on our patient. Look at that. 39,000 with 0 mistakes. Woo! Alright, guys. I'm going to go over to A10. I'm going to play this. We're going to do this real quick. Real quick. Dental implant. Nose. Knee. Skin. Shoulder. Epilepsy. And eye. Some other stuff. Let's operate. Let's do this. Screw it. Let's full screen it for you. There. Alright. While playing baseball, excuse me, James was hit in the mouth by a stray ball that chipped off a large piece of one of his lower front teeth. This actually happened to me before too, but it wasn't even playing any sports. You get this or not? Well, not get this, but believe it or not, I was going to a different school from the one I am at right now, but I was just sitting at my desk talking to some people, and all of a sudden, I just see this white thing come flying out of my mouth, and from the very split second that I see it, it looks like a chunk of my tooth. And the floor in the classroom was white tile, so I couldn't find it. Well, actually, I do believe I did find it, actually. But it was really hard, too. And so, I told my mom about it later on that day, after obviously trying to feel my teeth, see if I actually did lose any pieces of them. And, well, I come to find out I did. I lost a piece of, I believe, my canine tooth. Yeah, I did. But let's get back to this. It was a pretty neat story, but let's get back to this. Unfortunately, a dental crown is not an option, as too much of James' tooth was lost in the accident. Instead, the remaining dental material will need to be extracted and an artificial tooth implanted. Continue. Before we start the operation, we need to take an x-ray to check the health of the jawbone surrounding the chipped tooth. Positioner. X-ray. Perfect. The bone surrounding the broken tooth seems to be healthy. We can begin the operation. That's the chipped tooth. It has to be. Move the positioner. Well, why do I remove the positioner? It could help him. Keep him in the right place so I can do the surgery. To prevent James from experiencing pain, we will inject a local anesthetic at the surgery site. We will first apply a numbing gel to make inserting the needle less painful. Numbing gel. Alright. I just grab a drill and just start drilling right in. He won't even expect it. I don't want to do that. Pick up the needle. Oh, anesthesia. What was I thinking? I couldn't even see it. Good work. James won't be able to feel pain in that area for a few hours now. He won't be able to feel that area for a few hours at all. We will now use a dental elevator to loosen and elevate the tooth. Dental elevator. Holy shit! They're like pulling the tooth out with that little tool. Tooth using forceps. Forceps. Oh, good work. We will now use a surgical suction instrument to suck away the blood. Ratchet driver. Surgical suction instrument. It's literally called surgical suction instrument. Oh, God. Alright, now let's rinse James' mouth with water to wash away any leftover blood or bone material. Water sprayer. Pick up the surgical suction instrument again to suck away the water. There it is. Same place as before. Alright, it seems some gum tissue is still in the way. Please pick up the scalpel from the table. There's the bone. Excellent. We can now drill a hole in James' jawbone. Oh, God. 0.6 millimeter drill. That's a nice little handy drill, too. It's not even very big. And that had quite a bit of torque and power to it. We will use another drill to widen the hole. Pick up the 2.8 millimeter drill. Oh, God, that's a much bigger hole. That's it. Now we'll insert the implant. Please pick up the ratchet driver from the table. Ratchet driver. Now pick up the implant and attach the ratchet driver to it. Implant. Ah, shit, that went in deep. We will now make an impression of the implant. Please pick up the impression cap. Nah, we're ready to make, wait, what? Impression tray. We will place a temporary prosthesis over the implant while we prepare the final prosthesis. Please pick up the temporary prosthesis. We'll now insert a contour abutment analog into the impression. The abutment analog will help us create a model of the implant. Oh, abutment analog. We'll now create the model in dye stone using soft tissue material. Injector containing soft tissue. Good work. We will now place the contour waxing copy on the abutment analog. Now we'll finish the framework with a custom-made crown. You can now remove the dental crown. Alright. It's time to place the final prosthesis in James' mouth. Please pick up the final prosthesis from the table. Cement. We can now use the scaler to remove any excess cement from the implant site. Excellent work. We will now suture the gum tissue. Sutures. Congratulations, you have successfully completed the dental implant. Excellent work. Ooh. I want to do it as specialist as the hard mode. Let's try it. This is really hard. Like, I'm not saying that this is going to be really hard to remember, because as you can see from previous videos, I have excellent memory. I just haven't memorized one of these that's this long yet. Are you going to go? Alright, I'll reload you. Sorry, people. I'll not read everything, and I'll rush through it this time. Never mind, I could play as a specialist. Alright. Positioner. X-ray. Yep. Yep, that's what it looks like. Remove the positioner. Alright. Numbing gel. There. Anesthesia. Anesthetic. Alright. No. Dental elevator. I knew what it was. I just couldn't see it. Alright. Forceps. Surgical suction instrument. Water sprayer. Surgical suction instrument again. Scalpel. The extra bit of gum there. Alright. Now, the 6mm drill. 2.8mm drill. Alright. Oh, crap. Pressure tray. No, it's the ratchet driver. Alright. And then the implant. I was jumping too far ahead. No. Hold on, people. Hold on. Hold on. I'm going to reload this. Here, just real quick. I'm going to reload this. I know I should get to retry this, but I am. My memory is better than this. I'm just jumping way too far ahead. Alright, play as specialist. I'm going to go through this as quick as I can, but correctly. Alright. Positioner. X-ray. Yes, that is what his mouth looks like. I don't need to see it. I already know he has something wrong. And that I can fix it. Anesthesia. Anesthetic. Dental elevator. Alright. Forceps. Suction. Water sprayer. Suction again. Scalpel. Drill. Drill again. Couldn't find the other drill though. Ratchet driver. Implant. Impression cap. Yep. Alright. Impression tray. I know this because it went impression cap and then impression tray. Alright. I believe we're going to put on the temporary prosthesis. Yes, we are. Alright. Abutment analog. Injector with soft tissue. Put that on. Alright, with that, contour waxing copy. Custom crown. Put that on there. Works. Final prosthesis. Put the cement on there. Put it on there. And then with the scaler, take out any extra cement. Sutures. There we go. I knew I could do it. I was just jumping way too far ahead. Just jumping way too far ahead. But there we go. 18,900 for a hard mode bonus, and then I got that for my regular score. 37,800 with 0 mistakes. That was a pretty good time there. Alright. There. I think leg surgery is next. I think I'm going to leave this video off here. Hope you guys have a great day, and I will see you. If only a mouse would work. If only. But I hope you guys have a great day, and I'll see you in the next one.